So for people who have had an open surgery, the incision's a little bit bigger and we'll use a little different dressing. The one that I typically use is an Aquacell. It's a large dressing that's occlusive, and it will fit over the top of the incision and basically seal it out from the environment. The care for this is very easy. You don't have to do anything, just leave it alone. It can even tolerate getting a little bit wet, but as with all surgery when you have incisions, definitely during the first couple weeks, I prefer that not to get wet at all. Taking care of the incisions after surgery, I think, is very easy. First of all, I'd prefer the incisions not to get wet. So I'm generally okay that if you take a shower, you leave this arm kind of outside the spray of the water. If the water hits you and a little bit splashes over there, I don't think that's such a big deal. But generally for incisions, I don't think there should be any soaking, no hot tubs, no lakes, oceans, no baths. Generally you want to keep this pretty dry. Now the stitches that we typically use can be a little bit deceptive, and a lot of people are tempted to try and take their own stitches out. I really want to try and convince you not to do that. We put them in a special way, and if you take it out wrong, you'll actually leave half the stitch inside the incision. Typically those stitches will come out somewhat time between 10 and 14 days, and we'll typically pull those out inside the clinic. People ask about scars and ways to take care of the scars. Generally, I would prefer, definitely early on, when the stitches are still in and the incisions are healing, that you don't put anything on it. No vitamin E, no Neosporin. Those things really will not help you heal. Really all you just need to do is just leave it alone and keep it a little bit covered, like with a Band-Aid. After things have healed, let's say we're a month into it, it's also not uncommon to need to do a little bit of scar massage to try and help get some of that scar material to release. The way you do a scar massage is you just simply put your finger on the scar and rub the skin around it. This will help get some of the tissues deeper inside there to break up some of the scar tissue. Okay, so another very common problem that people have is how to get dressed when you're not supposed to move your arm. And particularly, the thing you want to avoid is lifting your arm up like this. This is what we don't want to see happen. So the best way to do this, and you can do this with a t-shirt, I bought a button front shirt because I think they're the easiest, is, well, I'll show you. So first of all, just let your arm hang down. So you can see I'm out of my sling. It's always okay to let your arm just kind of hang down by its side for a few minutes. That's not such a big deal. And what you're going to do is put the bad arm in first. So you put the bad arm in, keeping it down by the side, and you're going to put this so that it goes all the way up over your shoulder. Okay, so you can see my arm stayed down. And then you're going to reach around with your good arm. So if you can grab the sleeve. Always helps if you have help with this too. Okay, so you put your arm through the sleeve and bring it back around. From here, you're allowed to do the buttons. So you put the buttons down and now your shirt's on, and you haven't taken your arm away from your body like it's supposed to stay. One of the hardest things that people will struggle with after surgery is trying to figure out a way to be comfortable while sleeping. What I can tell you is that's the biggest challenge that I see people deal with. Generally, I don't care how you sleep as long as you're wearing the sling. I think you're completely allowed to lay flat if you can be comfortable. That being said, almost no patients are comfortable laying flat after shoulder surgery. I think that the weight of the arm and gravity does help pull the tension away from the areas that are very irritated after surgery. So what a lot of people will do is they'll sleep sitting up, say in like a recliner, or if you lay in bed, you could just put a bunch of pillows so that you're kind of sitting up. Generally, people find that that's a little easier to sleep that way. And then generally what you'll do is just very slowly start to recline backwards over the weeks as they go by until you're all the way flat, and then you can move back to bed. So I wanted to demonstrate how to do an appropriate pendulum. Pendulum is a shoulder exercise that is commonly done after shoulder surgery. A lot of people really do it wrong. So the concept here is that you're going to come out of your sling and let gravity take the arm down. The way people do it wrong is that they think this is a pendulum. They're using their arm using the muscles of their arm to move it around. This is the wrong way to do it. The reality is we don't want the muscles to pull on any of the repair up in the top part of the shoulder. So to make your arm swing, you're actually going to use your feet and your hips. So gravity is going to hold your arm like a pendulum, and you use your hips to make the arm rock back and forth like this. Okay, so it's a very different type of exercise. That's the correct way to do it. Some of the worst complications that I see after surgery come from people falling. Generally, a recently operated on shoulder really doesn't do very well in a fall. It's not going to be able to help catch you. Some people get very injured by that. So my general advice is, number one, just be very careful. It's not a bad idea ahead of time before the surgery to make sure that you've made your house so that you don't have a lot of tripping hazards around. If you have problems with your balance, it's really a good time to consider using a cane to keep you steady on your feet. And I also want you to keep in mind, you're going to be recent out from surgery, you're going to have the effects of the anesthesia in addition to having pain medications, so you're not going to be at your best. It's something that you really want to consider ahead of time and try and keep yourself safe. People ask me, what are the things that you could do ahead of time to try and help the recovery afterwards? I would say if you're a smoker, generally the best thing that you could possibly do is stop smoking. There are numerous articles that show that the nicotine in the cigarette smoke is absolutely poison to the tissue that's trying to heal. I think generally a good diet is a good idea with plenty of protein, calcium, and vitamin D. I'm not really aware of any vitamins that have ever been scientifically proven to help in recovery from surgery. So after surgery, some of the more serious concerns that we have that I think you should always be ready to call your doctor about are the following. First of all is the temperature. Any temperature over 101.5 is really concerning. Now, it's actually not all that uncommon to have a low-grade temperature for the first 2 days after surgery. I'm not sure that I would worry too much about that. But if you ever have a temperature over 101.5, I want to make certain that you contact your physician's office. I think also you should inspect the incisions daily. Any sign that it's turning red, like a sunburn red that's growing, or if it starts to discharge anything that looks like pus or fluid, it should generally stay pretty dry. If something starts leaking out of the incision, it's another thing we'd be concerned about for an infection, and you really want to contact your doctor. It should be generally getting better in terms of pain. If you're having a regular post-operative course, the pain should be getting less and less and less and less. If all of a sudden the pain goes way up for no good reason, another reason that you may want to contact us to have a look at it.